Three things to consider when planning pregnancy with multiple sclerosis. So, number one is that it is actually safe to get pregnant. And decades ago, doctors would tell people with MS not to get pregnant, but we know now that it's safe. There's no increased risk to the baby. There is a slight increased genetic risk, but it's not more than a few percentage points higher than the general population. So, just speak with your doctor about that. Number two is that pregnancy is actually a pretty protected time for MS. And what I mean by that is most women have a reduced relapse risk during pregnancy. However, that risk does increase postpartum because of all the hormonal changes. And so it's really important to have a good postpartum plan set in place with your doctor. And number three is that you ideally want to plan 6 to 12 months ahead of time if you can. And this is because a lot of the disease modifying therapies need to be altered or changed, or at least given some consideration before planning a pregnancy. So we know that there are some medicines that are very safe in pregnancies, such as Copaxone, or glutathione acetate, or the interferons. Those are injectable medicines, and those can actually be continued throughout pregnancy. And then some of the other medicines like B-cell therapies like Ocrevus, ocrelizumab, or Briumvi, ublituximab, those can be given a few months before conception, and those actually protect you long lasting through the pregnancy and can be planned, to be infused after you give birth. There are some medications we use in MS that are not safe for pregnancy, primarily Albagio or teriflunomide, and that's because it lasts a really long time in the system and can be dangerous and cause birth defects. So we typically want to avoid this in anyone of a childbearing age who's a female. But then there's other ones in between where you might want to talk to your doctor about options for extending the interval during pregnancy, such as Tysabri, or switching from something like an S1P receptor modulator like Gilenya to something that might be a little bit safer and not have a risk of rebound if you were to stop it, if you were to get pregnant.